think that a lot of individuals or couples going to a clinic just assume I'm just going for a medical procedure. I'm just doing IVF because I think a lot of people say, oh, just go do fertility treatments. And it's a lot more than just a medical procedure. It is a very vulnerable place that you open up yourself to. And it's a lot of grief. Majority of individuals or couples can say, like, I didn't expect that this is what it would look like. I never thought I would be moving through fertility or infertility and require a clinic. Just, I think what's come out in some groups and often discussed is the loss of control, the loss of spontaneity, the loss of a dream.
Welcome to the Red Thread, Fertility, Healing, and the Embodied Journey. I'm your host, Shreyasi. This podcast was created for women who are walking a medically assisted fertility journey, such as IVF or IUI, and feeling like there has to be more than just getting through it. More support, more understanding, and a deeper way of staying connected to yourself along the way. Here we explore the emotional, physical, and spiritual layers of this experience through honest conversation, shared stories, and insights to help you feel held on an isolating path. Wherever you find yourself right now, whether things feel uncertain, overwhelming, or heavy, you don't have to carry it on your own. This is the Red Thread, a space where you can slow down, feel what's here, and gently find your way back to yourself. Welcome to the Red Thread podcast with me, Shreyasi. This is the Red Thread, Fertility, Healing, and the Embodied Journey. I'm really excited to have our guest speaker today. This is Caroline Andersen. She's a psychologist who has spent most of her practice in reproductive mental health. She supports individuals and couples on their medicalized fertility journey, and she also supports her clients with grief and loss, infant loss, donor conception decisions, and much more. And Caroline and I have become colleagues and friends in the last year, and we do offer several fertility support spaces together. So I'm really glad to have you on the program today. Welcome, Caroline.
Thank you so much, Tracy, for inviting me.
I guess I wanted to start by just saying, what did you notice getting into this work, supporting women with IVF, IUI? And are there things that you feel are important for women to know?
It's a very good question because it's quite loaded. I think that a lot of individuals or couples going to a clinic just assume I'm just going for a medical procedure. I'm just doing IVF because I think a lot of people say, oh, just go do fertility treatments. And it's a lot more than just a medical procedure. It is a very vulnerable place that you open up yourself to. And it's a lot of grief. It's a lot of majority of individuals or couples can say, like, I didn't expect that this is what it would look like. I never thought I would be moving through fertility or infertility and require a clinic. Just, I think what's come out in some groups and often discussed is the loss of control, the loss of spontaneity, the loss of a dream, that dream of, having a baby and this looking a certain way because maybe everyone around you, it's just happened when they've decided, the loss of the trust of your body, the stress if you're in a relationship that it can put on a relationship, the certainty, identity issues. Who am I? I think that what starts as a medical, really, depending on what the course takes and how long it can take, can really shake someone to the very core and change the way they view themselves.
Yeah, thank you. It's amazing how we don't hear that message at all. And I understand that when you're going to a fertility clinic, the physicians and the nurses are focused more on your particular case, how your body is functioning in a healthy way for your age or not, and what they can do to increase the probabilities of success of you conceiving. But maybe I think there's just such a huge layer of the emotional aspects of how it forever changes a woman and a couple that that isn't mentioned when you first walk into a clinic. And I know we've talked about how can we perhaps put something together to educate women on what they're walking into, if they're single mothers by choice or partnered, and what that could mean. So you mentioned grief, and a lot of different griefs. And so I wonder if women even find like they don't even expect that grief will come up. And I know from our conversations that sometimes we have grief unresolved from earlier in our life and other life experiences. Does that ever come up as well when you're working with clients who are talking about grief?
Absolutely. I think that a lot of the times when you speak about grief, some people say this feels similar to this time in my life, or when I lost this, or when I had this dream and this didn't work out, that it feels similar. But I feel in regards to fertility and infertility, that grief is so much more. And I think a lot of people, like, it can be very medicalized that this is like a depression. And I often say it can look very similar, but grief is its own. And it can't always just be medicalized. It needs to be talked to and spoken about. But in our society, going through infertility and miscarriage and even a loss is not really a grief that's recognized. It's not a grief that everyone can identify with. It's not a grief that everyone sees. And in addition, not many individuals or couples start talking about it directly that that's happening to them. They keep it quiet for a very long time. So they're masking this and going through this grief on their own.
And I know we've talked about that is people expect and are very excited maybe for you when you say you're going to go and look at IVF or IUI and they think it's going to be a quick fix. I also wonder maybe at the start of the path, lots more people are available and supportive, but then say it doesn't unfold that way and you need multiple treatments or something medical arises, a complication. I don't know that support is available long term because people it's hard for people to know what to say to couples or women who are grieving. And I know we've heard lots of examples of things that ought not to have been said or said maybe with well intention, but has been really painful or hurtful to hear. What are some things you think people could be doing to support couples on this path?
I think that I always want to give and encourage everyone to give their friends and family, their loved ones, the benefit of the doubt. That there's no intention to say things to hurt you. It's because it's such a different grief, it may not be understood. And I think also there's a real discomfort. There's a discomfort. We want to fix things for people. We don't like seeing people sad. We don't like seeing people suffering. And we want to come in and fix it. And things like toxic positivity, like it's going to be okay. Or I had a friend that went through this and they just did IVF or they just did this and it worked. And I'm wondering often, when I speak to individuals or couples about family or friends, of really not necessarily feeling the pressure of a psychoeducation component of infertility, but maybe being a little bit forthright of like, this is what helps and this is what doesn't.
That's right. Asking for what you need.
Yeah. As opposed to assuming someone will know, just say it's almost better for you just to say, this sounds hard. What can I do? Like, I don't know. I've never been through this. How can I help you? What do you need from me?
Yeah. When you say disenfranchised grief, I would love for you to share a bit more. I've read about that, and my understanding is it's also has to do with it's not something that is visible. It's not something you can talk about. There are no cards in the store for someone to give you. There's no funeral or way to have friends gather or family to support you. So what do people do when they have that disenfranchised grief?
I think what we've also seen in groups, they isolate.
Yeah.
They withdraw because if they've tried and they maybe have had not a such good outcome of starting to speak about it and someone says something, because it's very vulnerable to disclose, I'm struggling to have a child, or we really want a child and it's not happening, or we're doing this. That in itself is kind of personal. And some people don't want to share that information. And so they start pulling back and isolating more and feel very misunderstood. And to those that maybe do go into it, they kind of have a mix. Like some people are okay. Some people, I'm not too sure. It's impacting relationships because it's not understood. And I think usually the best outcomes are the people that say, I've never experienced this, but I see you're suffering. I see you're struggling. How can I help you?
Yeah, that's great. I hope for people listening that they have people in their life who can say that, or they can perhaps ask for that. And I know we also talk about emotional labor and how much the expense of continually explaining or hoping other people would understand. So I hope that people listening to this podcast will also practice discernment. And maybe there are people in your life you want to have that conversation with. This is something I would really like from you to support me on this path because I care about you and I want us to be connected through this time. Yeah.
I think everyone also has such a different way of what support looks like for them. I think we've seen also that there's someone that are very open to talk about it, want to join groups. There's others that kind of love reading blogs or reading other people's experience and not feel so isolated. Some people want to write these blogs, and it's really finding what works for you, because I think the process of grief is so personal and there is no right or wrong way. It's your way.
Yeah, it leads really well into a question I had for you about grief. How can we tend to grief on this journey? And you've started talking about that, maybe writing your story, sharing it on a blog, speaking about it. And what about for women or couples who are on a different side? They don't like to speak much with others. How can they tend to grief on this journey?
I would really hope and really try to assist in, if you're in a relationship, to be talking about it, as painful and as hard as it is, to recognize like you were both different people and you will grieve differently, and there is no right or wrong, but can you connect with one another on pieces of this and just hear the other out? And I find also that this can be sometimes people's first experience with grief, and when you first identify it, it can be quite shocking to be like, yeah, that fits. This feels like a significant loss. This feels like something we really wanted, and I've lost a dream. I've lost my hope. I feel hopeless, helpless, out of control. I'm grieving what I thought my life was going to look like. I'm grieving what I thought our life would look like.
Yeah.
And I think leaning in, because we have a tendency of not wanting to feel these things, but spending a little time leaning into it and talking to it with curiosity, with compassion, with love, of recognizing like this is a part of the human experience. Grief is a representation of loving something and wanting something.
Yeah, it makes me also think about maybe just allowing people to know it will come up in your journey. This is something that is very natural, because someone shared that so poignantly in a group we had recently, where there's, how do I put it? Maybe gratitude or just pride in oneself that you're taking this step. You're going to do what you can to become a parent. You're accessing technologies that maybe weren't available to others and maybe still aren't. And yet, at the same time, there's this sadness that you're in this position in the first place.
Yeah.
You know, why am I here? Why am I not being an 8-year-old or a 10-year-old now instead of being here? So I just don't see anyone who doesn't have grief. Like, I feel like this is something it would be nice to let people know, is if you're having or feeling grief on this journey, that's to be expected. That's natural, you know?
I think the other thing as we talk about this that comes up is that disenfranchised grief it's not one event. That is, like, a lot of us can relate to a singular event, the loss of someone. And we grieve that person and we grieve that person's life, and time, we move away from it. I always go from a grief model. I don't believe we forget. I really feel we learn how to live with the absence of that individual. But with infertility, it's not just it's like these repetitive little cuts that continue to happen. Like if you just do IVF. You do an IVF cycle and it's unsuccessful. Not only is there grief of doing it, but then this didn't work. What's next? And there can be all these multiple episodes of significant loss throughout it.
It also makes me think about, and we've talked about this, just the impact on the body of going through these procedures. And just I know we've heard some stories, and sometimes they're so heartbreaking to think of, even certain procedures when they don't work and our bodies start to brace every time we go in for another procedure or another treatment. It's such a cycle of that. And I wonder if you've met many women who are quite numb or disconnected from their bodies on this journey.
Absolutely. I think that, as they often say, the more you do something, the more you get used to it. I really feel this is the opposite. The longer you're in infertility, I feel like our bodies become more sensitive. You feel touched out. Your body starts reacting differently to what you felt maybe a year or two ago, that you were like, okay, it's just a scan, or it's just that. You start tensing. You start a lot of people have talked about dissociating, like laying on the end, just kind of being like thinking of going to another place, which is not ideal. And everyone has such different histories.
That's so true.
We don't know what's happening when someone's having these procedures because there's a large part that's very medicalized and very invasive.
Yeah. And I was thinking, what is an antidote to that? And it's easy to say, I was thinking about this lately. We can say to be in your body, but maybe the wisest thing in that moment for the person, for that woman, is to not be totally in their bodies. I do think that, when we've worked with women and they've started to even connect to parts of their body, like their heart or their womb, through breathing, through gentle touch, it helps them feel safer to be in their bodies for periods of time. And I also think that the equine facilitated therapy work we do with the horses, so that was actually Caroline's brainchild. And she reached out after our meeting and we talked about how maybe the horses at Spirit Farm could be partners in supporting women in IVF and IUI. And then we've run a few groups and they've been so well received. And I wonder if you start to accumulate experiences of feeling pleasure and safety in the body, not just, like you said, having to be in a clinic and having all this pressure for it to go right.
I think we both heard from women saying, my nervous system hasn't felt this way in a very long time. And it's amazing to bear witness to women from when we're maybe having a discussion and we're really kind of reflecting on questions we may ask or feelings that may come up, to then we have a break and then go to the horses, that it's just lifted. And there is, we've heard, I feel like a childlike joy. I feel like I can experience being in the moment. I'm not thinking about anything else. It's been very powerful. Your herd of horses is absolutely
Thank you.
amazing.
Well, I think they really look forward to that time and they enjoy it. I also think, there's many reasons, but I think women aren't always connected to, they have such a big maternal heart and energy that they radiate on this path because they want so much to be mums. And I do think horses are so adept at reading energy and responding to it. And I think they're naturally drawn to the women in these programs too. And yeah, I do think being with the horses has really helped. And it's something I hope we can offer for many years to come, because I do notice that we can talk about something, reflect as much as we want, and we can have a really transformative or powerful moment, but it doesn't seem to integrate or land, or maybe it just allows the women a more room for integration, I think, to then spend time with our horses or just be a different part of who they are. Because some of it, I know the women have talked about this, is losing parts of yourself on this journey. Could you share a bit about that, Caroline?
I think that this loss of identity, there's so much loss surrounding this, that there's a real loss of identity. And I even would challenge just that loss of the world, this just world of a lot of us grow up trying to prevent pregnancy. And that when you want to have and want to get pregnant, it's just going to happen. And it's not true. There's many women. I mean, look at 1 out of 6, but I actually think it's even more than that.
That's 1 out of 6 women experiencing infertility, struggles with fertility.
Yeah, that there's this that once I decide to have a child, it's taken for granted I will be able to get pregnant. And it feels like I was sold something that's not necessarily true. I don't know how many women have said that. I was working on my career, I was doing all these things, and I assumed when I was ready, it would happen. Why is it not happening? What did I do wrong? When we can't find a reason, we internalize it. We want to know why as humans, but sometimes there is no why. Sometimes it's just unexplained. They don't know why. Even if there's an explanation, it turns around, what did I do to cause this? Did I do this? Did I do that? And so that betrayal, and that body and that significant loss of why can't I do what I and others take for granted and that I just thought was going to come to me easily.
Exactly. And I also, what struck me as you said that is we have this sense of, why is this happening to me? What is the reason? And there's no answer. So one has to really look at ways to accept that, but also to keep going for another treatment cycle. Because obviously there's a whole other discussion we can have on making a choice to keep going, or at what point will you decide this is no longer for me. But I'm always so amazed by how the women on this path keep going in spite of feeling that betrayal or lack of fairness in their life, right? It's almost, I think you have to give yourself some time to feel that, but also find a way to keep going, right? Because for some women, it's very important to continue. And we know women who've done this for years, and there has to be a part of you that still has hope, but also is able to I don't know, put aside what's happened so far, or some of the so-called failures. So it takes a lot of cognitive effort for these women and couples.
And strength. I mean, sometimes when we sit in these circles, I look around and think like, these are such strong individuals.
Yeah.
And at moments, just because they're feeling these feelings, they equate that this may not be strength. But I think showing up, talking about it, going through this and keep kind of opening yourself up to different things is real strength.
I agree. And that also makes me wonder, how important is it to have a community or a space where you can meet other women going through this, I guess, medicalized fertility treatments in your perspective?
I speak from personal experience that I personally went through infertility and I felt very alone and isolated. And I worked in the mental health field and I even thought, wow, like I barely spoke about it. I felt very uncomfortable talking about it and I really could not access. I did not have access to resources. And I always thought as I was moving through this, I thought no matter what way this goes, I really want to alter that. I really want to create spaces that individuals or couples or groups can come together and share this experience because it's one of the hardest parts that I think I so far have struggled with. And I certainly will not forget it. And to do it alone, I think makes it even harder.
Yeah. Thank you for sharing that part of your story. I really appreciate that. I know for myself, it's almost like taking off the training wheels. I'm just playing with this idea of sharing more about my journey. I think when you're actively on the journey, it's a little different, maybe in a year or two or however many years down the road. Once I feel I'm no longer on that journey, I might be able to share more. But I do feel that instinct to, not share it with people who would understand. And I think even just witnessing the women in our spaces, it made me realize it's such a medicine to have all of these opportunities where women can actually share some of these intense griefs or feelings and no one's there to judge. They don't have to censor. They can just say it. And there's actually other women nodding their heads and saying, yeah, that makes sense, or I relate to you. So I don't think people understand how powerful that is. So it's really special that we're creating these spaces. And I think if women are nervous about coming into a support group, what are some reasons they might be, or what are some things you might say to them? Are there other ways they can find support, maybe online or anything like that?
I think there's multiple resources. There's certainly online resources that you can read about experiences, right? I know a lot of people find comfort in reading. There's a delicate balance between that, about reading about an experience as opposed to reading about a medicalized procedure. I think everyone's medicalized journey through fertility is so different because it's very dependent on a multitude of things. And you can read some story and get very nervous about it, but it has nothing to do with your story. We're not the physician. You're to pick like what your protocol is or what your blood work says of what's recommended. So I think there's a different level of what support you're looking for. And I think one of the largest is like medicalized. Yes, it is, but let's talk about the emotions surrounding it. Because everyone that we meet in a group is there for a different reason. But the common goal and the feelings they share, that's common. They all want to get through this and have their dream. But in addition, they can share all the feelings surrounding it. And it doesn't matter what procedures or what their protocols are or things like that.
I know you've also collaborated with Alda, for example, who's another fertility practitioner here in Edmonton, and offered circles with her, and where women can also receive fertility-focused acupuncture and mindfulness. So other ways to support themselves.
Like community acupuncture, which is not necessarily coming in and talking about your feelings, but just being in a shared space. And I have heard countless times that women and couples have said, it's so odd. We're all going into this fertility clinic, but yet you sit in a waiting room and there's other people there and we're not talking.
Yeah, that is odd, isn't it? Yeah. I think everyone's looking at each other and wondering about their stories. Yeah.
And that was actually, I had one event during my journey multiple years ago that I sat in a waiting room after countless times of no one speaking to each other. We were kind of going to be waiting a long time for an ultrasound, and there was a group of 4 women, and we just started having this conversation. And in the process of 15 minutes, we laughed, we cried, we expressed anger, and it was really powerful. We never met each other before, and we never met each other again. But I remember walking out of there and feeling so different. And I thought, that's pretty powerful. I don't know you. I'm probably not going to see you again, but we just expressed and we just had a level of understanding. We didn't have to explain anything.
That's so remarkable.
And it was really, I thought this is powerful. And I think that was one of the things that really motivated me to want to start these groups.
Let's take a pause from the episode for a moment, as I'd love to share a few resources with you. If you're moving through your medically assisted fertility journey and feeling overwhelmed or disconnected, I've created a library of guided meditations and somatic practices to help you feel more grounded, regulated, and supported in your body. This is the Red Thread Library. If this feels supportive for you, you can explore more about the Red Thread Library at my website, www.shreysibroadhecker.com. And now let's come back to the conversation. That's really amazing. It feels like all of you were there at the right time and you all received something you needed that day.
Yeah.
Yeah, I'm sure the other ladies in this group of 4 feel the same wherever they are right now. So, yeah.
I think the other thing that's really come out of it that we've talked about in groups, like the change that happens for someone, you start looking for different types of relationships through this. That maybe the relationships that used to be okay now shift, and sometimes the circle changes. The individuals or groups that you are attracted to are altered. I think we've heard a lot like small talk, or it kind of puts life in a different perspective, or, I had this really good friend and we just are in different places. And can this friendship continue, or do we each need different things and this is our parting ways?
And then it's a real grief too. I know we hear it time and again of having really close friendships, but then life takes you in different directions. And so if you have friends who you were very close to, you all wanted to have children, and perhaps their journey moved ahead a little more quickly than yours, you're not always on the same wavelength or at the same parties or in the same gatherings anymore. So there's also, I think you're right, part of it is being more mindful of who you're friends with, and then our friend circle shrinking, and how do we compensate for that? And I can't even imagine to think of what the partners are going through, regardless of whether it's a same-sex partner or not. We've talked about that. There just aren't enough spaces for partners to receive emotional support on this journey.
There isn't. And we've talked about also how grief and how everyone manages it differently.
Yeah.
And some people seek support and how some people isolate. But we did a pilot group and we had heterosexual couples there. And it was quite striking of how many of the male partners were saying, there's not a lot of support. I don't really have anyone to talk to about this, and feel quite isolated through this, and reflecting like they even feel that their partners have more and that are far more open and manage this differently.
Yeah. And then of course, even other marginalized experiences, like maybe couples or individuals from different cultural groups, LGBTQ groups. I don't think we have enough support for those individuals on their journey and their experiences either. It almost feels like maybe medically things have advanced so much in the last several decades, and we're just catching up with how to support the emotional or the spiritual parts of the journey too. And I guess I'm wondering what are some things you'd suggest to prepare somebody earlier in their journey for the ups and downs of being in IVF for IUIs, or anything that comes to mind? I know we've talked about some of it already.
I think a lot of the preparation comes from who you are and being honest with what you've noticed in other parts of your life when you're under stressful circumstances, what helps you and what doesn't.
Mm-hmm.
There's a lot of people that want a lot of information, and I encourage them to advocate for information and ask the questions, write down the questions, ask if that's what helps you cope, to feel informed and understand your steps. There's some people that are like, I don't want to know. And that's your choice.
Yes.
I'm better not knowing, or I'll take it one appointment at a time.
Wonderful. I like that, because sometimes we don't want anyone to feel like they always have to fit this cookie cutter ideal client or patient on the journey. And some of us just don't want to know everything, and some do. And just knowing who you are, I like that, and how you cope with stress or with grief, and what keeps you grounded. Because I know it can be simple things like continuing to focus on your body, giving giving yourself rest, nutrition, like exercise, these things still matter. And it's not just so you can get the most healthy pregnancy. They matter for your mental health, I think, too. And obviously seeing mental health providers or getting that support if you need that also on your journey.
It's easy to get flooded with, I should do this, I have to do that. And often talking about going back to the basics. What does your intuition tell you? And I think you've done a lot of work around that in one of your groups around trusting your intuition.
Yes.
You can listen to your intuition
Yeah.
and trying to really speak to it in a way of, what do I need in these moments?
It also makes me think about, what if we've never tried that our whole lives and we're on this journey? How do we get started? How do we figure it out? And I think that you learn so much on this journey. You could have a PhD in infertility by the end of this journey. And it's not just the medical statistics and the details. It's also your health and, ways to cope emotionally, how to plan for the future. And I know for some of our single moms by choice group, it even comes up like, what will the next several years look like in terms of maternity leave or raising my child or having a community to help me? It's so much to plan. And I think in a way, I know it's a very different conversation than maybe parents who haven't been on this path, who haven't had to do IUI and IVF. There's some similarities, but it's almost a whole other level of planning that maybe people don't appreciate if they haven't ever had to do IVF or IUI.
And I think another thing, as you say that, how many individuals or couples do we hear from that said, any other time in my life when I decided I wanted to do something, I worked really hard and I achieved it. And I think we see a lot of women that are very achieved and very focused and are struggling with, this is the first time in my life that I have thrown everything at something and it's not working. And I continue to throw everything and it's still, I'm not getting the results that I want. And it's a real shift. It's a huge shift. And I think it's destabilizing for many.
It is. I can 100% relate to that myself too. And yeah, I think for me, and someone had said this, I've had to also do this is find patience and understand like things don't always unfold in a certain timeline. I remember earlier in my journey, I had a calendar and I mapped out the next 6 months to a year. And then I realized none of that is helpful. It just makes me feel less in control and disappointed. And it's easier to expect things happen along the way. Maybe you'll have something medical that needs to be taken care of, or maybe you realize that you want a bit of a pause. Maybe you don't feel like certain decisions, because these are heavy decisions. For example, if you're at all exploring donor conception or a sperm donor or an egg donor, sometimes this takes a short period of time. Sometimes it takes months because you have to be ready. So I think people maybe that's something else that it would be nice for people to know at the start of their journey is you just never know how long it will take. It doesn't mean you're doing it wrong or you're somehow screwing up. It just, life does that. Occasionally you need to take more time with certain decisions, or other things happen in your life or with your job or with your health, and it doesn't flow the way you expected.
I think that's part of the grief too, that timeline.
For sure. Yeah. Especially for women or partners couples who are starting a little bit later in life, which is everyone, even people who've wanted to conceive naturally after getting married and they've worked a few years in this process, or I say worked because it feels like a bit of work, not just enjoying time together. And so most people come to it a little bit later, and we often given that message around time. Every cycle counts, every egg you release or ovulate with counts. But I think you make your own timeline, and sometimes it's imposed on you by things outside your control. And so how can you live with that? I think that's something that I think people don't always realize when they start out. It just feels like, oh, by next Christmas, I'll be pregnant and I can plan that maternity leave or something.
Yeah, that self-talk, right? Really of how you're speaking about this is so imperative. Putting these types of, by this time I will be, I'm wondering if there's different ways to challenge that way and to really look at what do we have legitimate control over and what is on the outside that we do not. And sometimes breaking those things into a visual is really helpful, and focusing on what do I have control over? I do have control over some of the things I say to myself. I do have control over talking to myself differently about this.
And being kinder to oneself. That comes up a lot in our groups, is how can we be more compassionate to ourselves? So many of us have that self-criticism or that voice in us that has maybe a bit acquired through childhood and just has kept going. And maybe it's never been great to hear that voice, but we've dealt with it. But when it comes to infertility, it can go haywire if we're constantly hearing that voice in our heads. In your perspective, Caroline, what are some reasons that infertility is often hidden or stigmatized? Yeah, because I know you said earlier 1 in 6 women struggle with infertility, but the numbers are probably higher. And I know things are shifting. This is becoming more of a conversation about infertility, but it still is hidden. And I wonder, like, what comes to mind for me, one of the reasons is, I don't know, I think this pressure, societal pressure, expectation on women to be fertile, that's why you were on some level created to have children. And I know that it isn't that way for many women, but that feeling comes up for some women, I think, or some in groups we've shared with, and they think, I'm not doing what my body should have. I'm not being the woman I should be. And so I just wanted to name that. I think that's something that feels very stigmatized for some women, just feeling less like a woman because they can't conceive.
I think that is exactly one of a very large reason. And to share that feels very vulnerable. And if there's a diagnosis, feels even more vulnerable to be able to.
You mean like endometriosis or PCOS?
A lot of people don't even know what endometriosis is.
That's right.
A lot of women have to explain, and it's like to have a painful period, or is like, oh, mine's not an issue. Why is yours an issue? And then not understanding the repercussions of endo and what that can do to some women on their fertility journey. But also, if it's male factor, is that something that is openly discussed, right?
And just, I'm sure those listening will understand that, but how would you describe or explain male factor?
Male factor infertility, I believe at this point, they say could be 40% of the reason of infertility. And it can rate, like they can be for unknown reasons, but it's basically a contributing factor to why a pregnancy isn't occurring. And it can be for medical reasons, and it can be for genetic reasons. And a lot of the time, what I'm finding, a lot of people have no idea until they're trying to conceive, and they start going to a clinic and getting tests, and they're testing both you and your partner and finding out if there's an explanation, and the explanation can come. And I think for a lot of men, male factor can feel very much stigmatized. Like I've heard from a lot of men, like, I don't feel as much as a man. I feel like this is embarrassing. If some of my friends would know, that they would think I'm not very masculine. But I have spoken to men that are saying I'm very open about it. This is like, for whatever reason, this has happened to me. But I think it's vulnerable to talk about your feelings associated with this. It's scary to put it out there and not know how someone's going to react. If someone will make a comment that could alter a relationship, and how would you address this? I think the fear of judgment. I think that sometimes people have experienced that they've put this out there, and we've heard all these comments, oh, just go on a vacation, or you're too stressed. I know people just go and do for IVF, you'll have a baby. I know someone that did that. I think there's this fear of this, which is understandable. And it's the one thing you do control, actually, of who in your life knows and who doesn't. And maybe there's lots of control. I don't have any control of this, but I have control of what I do with this information and who I invite into knowing this.
Yeah. And I know we've had occasionally clients who might come from different ethnic backgrounds. And then there are maybe some unique pressures with their extended family and how they can acquire support or even speak of it without feeling judged. And I know that every year there's a theme around Infertility Awareness Week in Canada. And the theme this year was unlocking fertility. And I think that also speaks to how it's just sort of shoved in the closet. No one knows about it. Part of it is, I guess, couples are allowed to not share if they don't want to. But if it's a situation where you really wish someone could understand or don't know where to start, that's where hopefully listening to Caroline, myself, you'll feel like you have some ideas of who you can start sharing with. And if there isn't anyone in your current circle, maybe finding an infertility support group online might be a first start. Yeah.
I think the thing that we haven't touched on is the financial strain.
Exactly. That's yes.
That we hear, I hear from the financial strains by single moms by choice, by same-sex couples of, like a lot of wanting to go to a fertility clinic, not necessarily because they have infertility issues, but this is the path to become parents. I hear from a lot of same-sex couples, like we always knew this was our path that we wanted to be, but a lot of resentment or feelings about like, this is quite expensive.
Yeah. Well, and isn't Alberta the only province that doesn't cover
Yes.
fertility treatments for anyone listening from Canada? Because that's where we're based. So
yeah, quite overwhelmingly expensive fertility treatment.
exactly.
And I think it's a lot of stress on individuals or couples.
Yeah. And it's restrictive, isn't it? Like you have to decide if you can afford to buy this for your home or go on a trip or even, let alone saving for children down the road when you still don't. Every cycle is a lot of investment of finances, emotions, hope, and sometimes life shifting, like taking time off work or that kind of thing. So
I think that's a large stressor that often comes up. Like we're talking about the emotional component, but also carrying that.
the financial load.
Of just being like, this wasn't also expected. Some may have known, or some individuals may have had a better idea, but there's a lot of people that feel this totally caught us off guard. Like we have to think about our financial future. We have to think about these things. And then they feel very pulled about a child that means everything to finances.
It is a horrible pull. And then the quandary of how far can you go? What can you realistically afford? You think that that shouldn't have to be a consideration, but it is in real life a consideration for many. How far can you go? How many more treatments are you willing to explore? And
I think that's a lot of anxiety of what we can see is that
that's right.
That underlying is that since it hasn't happened the way we thought, there's this underlying threat. Is this going to happen? Will we have to stop due to what, right? What is this going, like, how far can we take this? That feels very threatening.
It is very threatening. And then I guess related to that, I just wanted to also highlight, since you do so many different kinds of support and work and you're so versatile, but one of the things that you may support clients in is what are other options now? If your IUI or IVF weren't successful and you've tried a few times, is it possible for you to look at different other paths to parenthood, such as donor conception or adoption? And or surrogacy, and it must be hard to have those conversations with clients.
Absolutely. And I think it often starts usually with their clinics after trying, and this is sometimes mentioned, and it can be met with many different feelings. Some people will say, like, I intuitively knew this was going to go this direction. I just needed to try, or that is not what my family, like, that's not what I envisioned. Everyone has different lines to how far, you can use donor sperm, you can use donor eggs, you can adopt embryos, you can look into adoption.
Yeah.
There are multiple ways, and everyone is so different of what they envisioned around what their family looked like. And all these different it could have started in one way, and it can really morph into something you never thought it was going to be. And just as we talked about time, these things take time and really reflection. And just because it's not what you thought it was going to be doesn't mean it can't be beautiful.
That's so true. Thank you for naming that, because there is grief with shifting your path or pivoting. And we make decisions based on how we're feeling now. We really don't know what the future will hold. And, there's the possibility for fulfillment even on these other paths, even if it feels devastating to even have to choose these paths.
There's opportunities out there. There's different opportunities, but it's really a reflection of, does that fit for you? And everyone has a different answer.
Exactly. And I think it's important for women and couples to know the options, and then maybe they won't want those options, but at least they're educated on those options so that they don't feel like they were left in the dark or they spent too much time going down one path and not looking at other options. And I think that's great. I mean, in terms of how that information can be relayed in fertility clinics or in other ways so that people know what other options there are. And that might influence how much time they spend going down one path or another.
Exactly.
I wanted to ask, Caroline, when you are working with same-sex couples, are there any particular aspects of the emotional experience that feel unique that you'd like to share about today?
I think part of the emotional experience is often with same-sex couples about choosing a donor. It can be like obviously one is allowed in any circumstance when selecting an egg or sperm donor to find someone that they may know that was in their circle to someone that's maybe in a broader circle to then using a sperm bank or an egg bank, a donor egg bank. And often these conversations are quite interesting to be having when you're looking for donors of what matters to you, right? And there's something that's really actually that's very different, especially when you're talking to two women, is there's something that you can do reciprocal IVF, which is really, I think it's really
Could you
cool
share
that
more about that just for listeners?
I always have these are some amazing conversations when I'm talking to two women, and there's this really strong desire to, maybe there's one partner that's saying, I always wanted to be a parent, but I don't necessarily feel a strong desire to carry. And the other partner saying, but I would like to use your egg. So can you do the IVF
Right.
cycle?
They can do the egg retrieval aspect.
I will carry. And I think it's a really powerful choice.
That is I agree. And it's an opportunity available, which is, I think, quite special. And it just also makes me think about, we don't always give medical technology enough credit. But if we think about, if we'd had this conversation 50 years ago, how different the landscape would have been. I think we're in such an exciting time for some of these technologies, and they're constantly being refined. So I do think we're very lucky to be speaking about infertility and IVF and IUI in this decade. Of course, it will keep improving. Who knows what the next 50 years will bring? But
yeah, the other thing that often comes up is just the openness around sharing, around talking to children, around donor conception.
yes, I
completely
was going to ask that. Sometimes people wonder how that should go. And I know this is a really interesting topic. What would you say? Like, what are some things that people can consider when they're sharing? It affects them making a choice around donor conception, doesn't it? Thinking about what they would say to their kids.
I think there's such a difference, and I think people's cultural backgrounds really play a difference also. But what I notice is, a lot of the research has shown the best case scenario for a donor conceived, and egg, embryo, sperm, is to be open about this, and that children conceived this way grow up always knowing this, that it's nothing that necessarily was just, oh, by the way, we're at 13 years old, they're told about this. And when I speak to couples that are same sex, it's always like, absolutely, we are so proud of our family. We're going to talk about this and be very transparent. It's quite beautiful, actually, about just the openness and the communication often that's happening between these partners, of also saying, when I say, like, if I can't do it, you can do it. And just like collaboratively deciding these, which is very unique.
It is. It is. And then it also makes me think it's just part of someone's origin story. And there's really a number of excellent children's books and resources that you know of, Caroline, as well. And that can support a parent in sharing, a parent or parents in sharing the story at different developmental levels appropriate for your child's age. And I like that you also mentioned it is important for people to realize that when somebody knows where they come from and that story, it allows for them to have better psychological outcomes and well-being as they grow up. So
I think you can create your narrative around this, and it may not have been the story you thought, but I also have a lot of parents deciding to make their own books, to say, like, I'm going to take, like, if it was a donor sperm, like, we're going to create our story of how we met and what our dream family was, and put a storybook together that we will share with our children.
That's beautiful. That's actually something it kind of anchors me, is to think about what are some photos or stories I'll share along the way. And I think even different paths you've taken to get to having your baby, they matter. And I think your child will be curious to know all the different things you've explored before you were able to meet them and bring that into reality. My last question is how do you think women or couples can advocate for themselves on this journey? It's a big piece that comes up sometimes. And I know you're such a support for them to kind of learn different ways. And I know even being in a support group, that's one of the advantages, is you hear stories of other people on this path and what they've found work, what didn't work, and it can give you some confidence. But do you have any suggestions on how we can advocate for ourselves on this journey?
I think that because you kind of come into a clinic and you may not know anything about anything, like to just say, okay, we've been referred here because we've been trying for this amount of time, or this has been happening, to when you go through the test and you have these consultations, to prepare for them and maybe write some things down of what keeps coming up for you. What are some things that would help you understand what's happening, and ask. I think that if you're presenting this to your doctor in a way of like, this helps me, this helps me understand. I often encourage individuals to be very direct with their physicians about, I'm really anxious about this test, or, can you talk to me while you're doing this? Can you tell me, or don't talk to me when you're doing this? Or could someone hold my hand, or could I bring someone in? I think it's the same thing, advocating of just not being scared to speak up for yourself. I know for some it can be really uncomfortable, but I think, it's very important, because so many times you can walk out of there. And I think it's better than Googling things. Honestly, ask your care provider. They understand your test results. They can speak to what your treatment is and what you're going to need, as opposed to just like, there's so much you can find that may not be at all related to your treatment plan, that could send you in other directions and add anxiety when that's not even a part of what's going to be happening for you.
Thank you for that. That is important. And that's another piece, I think, when you start the journey, you kind of know yourself. And are you someone who feels comfortable using your voice and speaking up? And it's okay wherever you're at, but how can you start to build that muscle? Because I do feel really strongly we need that capacity to ask those questions and not feel scared or embarrassed. And if that is something that's happening chronically, maybe you need a different fertility provider. Maybe that isn't a safe or comfortable relationship. But to take that accountability, because unfortunately, you may end up moving clinics. You may end up doing your IVF overseas. You may end up doing all these things because there's so many possibilities available to those with the financial means these days. So it's important to be able to ask those questions and then look at the pros and cons and what feels right for you as you go on your journey. So
I think it's also good not to go alone to these. Like, if there's someone, if you're in a partnership, to bring a partner. If you're not, to bring a trusted friend or family. Like, just to have that other person with you, not only to just talk about it when you're driving home, or talk about, what's happening when you're going, or maybe is in the room with the consult, like asking questions, or can remember things that you may not remember.
Yeah, I always find like when you're in a room like that, you may underestimate how your body is feeling and how you can process information. And it's just nice to have somebody there to ask questions, or who knows you and knows what you might want to know. Or if you don't remember everything, even if you're writing notes, you have somebody else with you to say, no, that's what they said, or this is what they said instead.
I know we've heard from a lot of people at these consultations, they feel like a lot of information is coming at them, and they get out and they're kind of like, okay, I'm confused, but now my feelings are catching up with me. That, we go into different survival strategies when we're receiving medical information, and sometimes we're not receiving things that we were necessarily expecting.
Give yourself space. Maybe you have to go back to work that day, but give yourself time, like a few days or even the weekend, to just process what you heard. Let yourself feel what you're feeling. Have some ways to take care of yourself. Because you're right. Sometimes we hear things that we didn't expect, or maybe we did expect, but hearing it is a different experience than reading about it online or expecting it. It makes it real somehow. And your fertility provider is telling you these are the odds. This is what I would say would happen with this procedure or that procedure. Yeah.
There could be a lot of stats coming at you, and you can get a bit confused. And I'm always encouraging, kind of in these initial consultations, you're not forced to make a decision right there. You're gathering information that hopefully you can go and maybe not talk about right away, but reflect on over the course of the next few days about what fits right now.
And Caroline, if there's listeners, or there are listeners wanting to know more about what you offer or connect with you, how could they do that?
They can, I guess, just look me up, Caroline Andersen, psychologist, Edmonton, and you'll find my information to connect and reach out.
Yeah.
And that oftentimes we're advertising some of our groups, and usually the equine group is happening in spring and summer and like early fall, right?
Right. And they can always look at your website for Caroline Andersen, psychologist in Edmonton, or you can look at ShreyasiBroadhecker.com, and we'll have information on those offerings.
Last year, we moved kind of the group into my office space. When we outside with the horses. So there's a lot of different options.
Thank you so much for being here, Caroline. This was lovely. And I really appreciate all of your expertise and the tips you shared for people who might not know where to start, or maybe they've been on the journey for a while and they just wanted some other perspectives.
Thank you so much for having me.
Thank you for taking the time to join me today on the podcast. If this episode resonated with you, please like, share, and leave a review. You can also connect with me at my website, www.shreysibroadhecker.com, or at Instagram at Shreyasi_Broadhecker to stay in touch and explore more of the work I do. Take care, and I'll see you in the next episode. Disclaimer. The content shared on this podcast is intended for informational and educational purposes and is not a substitute for medical or psychological advice. Every fertility journey is unique, so I encourage you to connect with your healthcare provider or qualified professional for support that's right for you. Any views or opinions shared by guests are their own.